Twin pregnancies are a very interesting topic in obstetrics, and most of the time people think of twins as either identical or non-identical. But from a medical standpoint, we have different ways of looking at twin pregnancies. I'm Dr. Monica, a board-certified OBGYN and mom of 3, and in this video I'm going to talk to you about the different types of twins. So most people think of twins as either identical or non-identical, which is certainly a good starting point. But from a medical standpoint, we look at things a little bit differently. Now, identical and non-identical, also identical or fraternal twins, means that if they're identical, they were one embryo that's split into two babies, whereas if they're fraternal, that means that two separate embryos were formed. Now, fraternal twins are the same as siblings that were born in different pregnancies. The genetic makeup is slightly different, same as a brother or a sister would be, and sometimes these twins are either both girls, both boys, or one of each. Whereas an identical twin that was one embryo that split has the same genetic makeup in both twins. So when it comes to looking at the twins and from a medical standpoint, we usually will name them or talk about the twin pregnancy based on their placenta and their amniotic sac. So the way we name these twins, based on the placenta and the amniotic sac, has some kind of long names associated with it that you might have heard before. When talking about the placenta, we're talking about what's called the chorion, and that will turn into part of the name that we use for the babies. When talking about the amniotic sac, we're talking about the amnion. And when we're talking about these, we're talking about how many of each. So the most common type of twin has two placentas and two amniotic sacs. Each baby has their own placenta and their own amniotic sac. So since there are two of each of these structures, these are called dichorionic, diamniotic twins. Dichorionic meaning two placentas, diamniotic meaning two amniotic sacs. Big words for sure. Now, these twins, which we will shorten and call di twins for dichorionic, diamniotic, are either fraternal or identical twins because either two embryos may have gone ahead and implanted into the uterus and formed their own placenta and amnion, or the one embryo that split may have completely split and formed one of each for each pregnancy. So di twins can be either fraternal or identical. Now the other types of twins are all different types of identical twins because these will sometimes share either a placenta or a placenta and an amniotic sac. And the degree to which they share parts of these structures depends on when the embryo split. So an embryo that split a little bit later than a di twin then have the situation where there is one placenta and two amniotic sacs. So one, of course, is mono. So for this, we will say monochorionic, diamniotic twins. One placenta for both babies, two amniotic sacs. So for short, we will call these mono-di twins. The next step up from this, meaning that the embryo split a few days later, is when the babies will share both a placenta and an amniotic sac. So there's one placenta, one sac, so this is monochorionic, monoamniotic twins, or for short, mono twins. Now these twins are quite rare. These only occur naturally in about 1 out of every 10,000 pregnancies. Now these occur more often when we're using assisted reproductive technologies like IVF, but in general they naturally occur very rarely. Now the final type of twin is, again, a few days later that embryo split, and these are when we get conjoined twins. Now conjoined twins are extremely rare. These only occur in 1 out of every 50,000 to 100,000 pregnancies. As you can imagine, these can certainly have a high risk of complications. So those are the different types of twins and how we call them in the medical world. It's based upon how many placentas and how many amniotic sacs there are. Now, as the babies share more and more structures, meaning they either share a placenta but have separate sacs, or share a placenta and share an amniotic sac, there are increased risks to those pregnancies, and they need to be monitored more closely to make sure that both of the babies are developing well and healthy. So that's a rundown of the different types of twins. Definitely more than just fraternal and identical, and some kind of long Latin sounding words to go along with it. But now you know the terminology that medical professionals use for different types of twins.